Well, continuing with our musculoskeletal ultrasound course for students, residents, fellows, and rotating interns at Fundación Valle de Lili and ISISIC, we're going to talk about our shoulder evaluation protocol. Remember, this is available exclusively for academic purposes on our website and on our YouTube channel. Before we begin, this chapter is important. It's important to make sure that we've already reviewed this previous module. These are basic anatomy, where we've learned about the grade scale and how to identify these types of anatomical structures. With the concepts of basic sonography, we should be clear on identifying the different patterns, which we discussed in previous lectures. So when we start talking about the shoulder segment, we begin with an anatomical segment. And remember that our image is basically going to be a reduced grayscale, and we will only see segments the size of our probe. So in this anatomical case, if we have a rotator cuff like this, and we put it into a grayscale image, and we recall each of the structures that are inside that box provided by the ultrasound image. So we are going to clearly identify our tendon with the different patterns we've already studied before, with the muscle patterns, tendon patterns, and bone patterns, so we can make sense of a grayscale image, like in this case, where we can clearly differentiate all the structures using the basic concepts. So in our protocol, position 1 is the position where we are going to study the anterior segment of the shoulder, and it might be the most important one to learn. We have divided it into several subsegments, and here we find the vast majority of pathologies that can be evaluated and, in many cases, treated with ultrasound, with the help of ultrasound. This segment, which anatomically we all must also know in order to identify each of these structures. Structures in the ultrasound, right, just as we talked about the already identifiable patterns. This will then allow us, with our ultrasound machine, to perform an evaluation in this position. First position, position 1, anterior segment of the shoulder. The patient should be comfortably seated facing the examiner. It can be done in other positions, such as lying down, but we do it with the patient seated, with the elbow bent at 90 degrees. That way we can move it in external or internal rotation. But the diagram is meant to illustrate the position the person being evaluated should be in. We will always identify as the first structure, my friend, the biceps in its long head. That is the first structure to identify. We'll see how we're going to do that in a moment. But please do keep in mind that our comprehensive sequence of actions always commences with the initial and crucial identification of the biceps muscle as the primary reference point. This holds true whether we precisely identify it at the level of the prominent pectoralis major muscle or right at the very start of the bicipital groove. Ultimately, the specific approach taken for this initial identification largely depends upon the individual examiner's clinical preference and established methodology. So, in addition to the pectoralis and the biceps, we are also going to identify the subscapularis and, of course, the rotator interval with all the ligaments that make it up. Oh yeah. The anterior and superior ligament complex of the shoulder, which we will also look at one by one. In this position, we will identify the conjoint tendon, the coracoid, and basically we're going to make this drawing that shows us how the probe will be positioned. So first, in the transverse position, we are going to identify our anatomical segment, keep it in mind, and identify it according to the parameters and according to the basic identification concepts. Our transverse position for the biceps, which, as we said, is the first structure we are going to evaluate, we do a scan. I actually do it this way, from the start of the groove toward the distal end, while many of my colleagues begin from the pectoral area toward the proximal end. Basically, the structure we are going to identify then is the biceps in transverse view, using the fundamental structure identification concepts from the previous chapter. So a tendon that gives us a salt and pepper appearance is a tendon. It has a lot of anisotropy, which is why we see it as hyperechoic, very bright within a bony structure that we also already know how to identify by its posterior acoustic shadow. Here, we basically evaluate the bone cortices, the patterns, which are what we use to identify each of the muscles, also already recognizable by each of us. So what is the segment to study? In this case, the key to studying this area is the biceps, which we can see with its distinct characteristics. We scan it distally until we reach the insertion of the pectoralis major, which we will identify. Also, passing just below and its insertion into the humerus with the muscle pattern above corresponding to the deltoid. So we go from a schematic image to a real ultrasound image, transverse axis. Biceps position 1, and let's look at it in more detail in this ultrasound image. We start from the proximal part. We're going to do a sweep as shown in the drawing, descending until we reach the pectoralis. The first image to identify then is bone images with our bicipital groove and the biceps. We'll see that we can also identify it there, even the transverse ligament, this whole anterior and superior ligament complex. But for now, let's start by identifying tendinous pattern, highly hyperechoic. Look at the heel-to-toe maneuvers being performed to take advantage of anisotropy and follow the same segment. Don't get confused. We'll see this in pathology, how to identify. And we scan all the way until we reach the pectoralis major at its insertion. And you can clearly see the tendinous pattern. Then we'll go back to the most proximal portion again and complete the study in the first transposition. First image to identify: biceps in transverse from proximal to distal. When we identify these types of patterns, notice that the biceps will always appear hyperechoic. In this case, it's pathological. And I'm showing this example so you can compare it to the previous images, where we saw a completely normal pattern with no visible fluid, or that anechoic or hypoechoic image around the biceps. We'll cover this later in the pathology segment. This is a biceps that we can clearly follow, in this case, surrounded by fluid and with a loculated area. Even though this is the sonoanatomy module, the point is to show that even when there is pathology, we'll recognize it because we can identify our ultrasound patterns. This is a diagram. The previous one is, let's say, more exaggerated. It's a humerus. 3, this is a humerus one. But part of the initial recognition is first identifying the fundamental anatomical structures, the characteristics of each of the normal tendons, so that later we can start to identify what is pathological. Now we just need to focus on recognizing the patterns we've already evaluated previously, as seen in our earlier modules: muscle, tendon, and assess each of these structures. So now with the MNG trans in the same position 1, after having evaluated the biceps along its entire path and throughout its course in the transverse view, let's look at it in the longitudinal plane. And in our diagram, the green image shows how we need to position our probe to view it in the longitudinal plane. We already saw it in these two. This is the initial path, now in the transverse view. And basically, I placed this drawing here on its side because that's how we'll evaluate and view it. On the ultrasound, when we place our probe in this position, the screen will show us this. So we're going to identify our cortical bone patterns that we already know, and we're basically going to look for this image. We're going to identify the muscle, the deltoid, now in the longitudinal view, with the characteristics we've already seen. With a biceps that in this case is a pattern, a well-organized laminar pattern in the longitudinal view, different from the transverse view, over an acoustic shadow that corresponds to the humeral head. So let's keep looking at the biceps in the longitudinal position. And starting from the previous transverse position, if we want to evaluate it, we rotate the probe to get this image on the right with a very well-organized fiber pattern. Notice that we can keep looking because it needs to be evaluated along its entire length, across its whole width. This is very dynamic, so look, here's the origin, already from the muscular part and the distal part. And we keep following it, evaluating each of its details until it enters the joint, evaluating its thickness, the presence or absence of fluid. But for now, it's about identifying the normal anatomical pattern. Biceps, first structure, position. 1, in the anterior part of the shoulder. So we continue with position 1 for our shoulder evaluation module, for shoulder anatomy. Now, the second structure we evaluate here in position 1 of the shoulder is the subscapularis. Let's look at it first in the long axis. And basically, the anatomical representation is of this little box where we're going to place it in transverse for the biceps, which would represent longitudinal for the subscapularis, meaning following the direction of the fibers. This is the long axis because we're following it, the direction of the fibers. It's the equivalent of transverse in the biceps, but here it's the same pro position. But pay attention, we're going to look at the long axis, meaning the fibers along their entire length. Let's look at it here more schematically so we can identify it. Bone pattern with posterior acoustic shadow. The subscapularis footprint is a very flat footprint. It's very flat, and on top of that footprint, we're going to look for a longitudinal pattern of tendons, as we already know, identifying well-organized laminar structures. Well-organized laminar structures. In this case, this would be the drawing that represents the other structures. Structures with posterior acoustic shadow, bone, coracoid, humerus, which are the starting points. And then the reading of each of the different elements of the grayscale and the patterns we've already recognized. So the subscapularis foot cut. Thank you. In the long axis, which would be like when we did the transverse on the biceps. Let's look at it dynamically then. If we've already finished evaluating our biceps in the same segment, what we do is put the patient in position 1. Let's see how we externally rotate the arm. We externally rotate to properly expose the footprint and have a flat, well-exposed footprint of the scapularis to elongate that tendon. Remember that with external rotation, we move it outward. We can see it better and define our footprint. So we identify our structures dynamically. The coracoid, the humeral head. Always remember to read the ultrasound. Always. Identifying patterns. Muscle pattern, tendon pattern, ligament pattern. We already saw this before, but this is the position then. 1. Visualization of the subscapularis in the long axis. It should also be evaluated dynamically to determine whether, for example, there is subcoracoid impingement, which is described in the literature. But in this case, it's basically about anatomical identification. We'll look at pathology later and see what we need to look for here. For now, it's just identification. So your second structure in position 1 is your scapulum. Now let's look at it in the short axis. The short axis of the subscapularis would be with the probe in this position. So let's remember that we started with the position 1, evaluating the biceps tendon in transverse, which is equivalent to the long axis of the subscapularis. And the long axis of the biceps is the short axis of the subscapularis. This is because of their arrangement, as shown here. The biceps comes in this direction, from proximal to distal, while the subscapularis goes from medial to lateral at its footprint. So this is the long axis, which is the one we saw, and the short axis would be with the probe in this position. It's the opposite then to identify it with the biceps, in terms of axes, whether it's long or short. Finally, identifying this muscle is very special because we have to remember the anatomical model. Remember that the subscapularis is a very special tendon because it has between 4 and 6 subtendons that can also be evaluated on ultrasound, and they attach to a very broad footprint on the lesser tuberosity. So always look for that foot cut. Look, this is the pattern of the subtendons, which can be seen in a conventional arthroscopy when we're operating on a patient, and it can be perfectly identified on ultrasound. Don't mistake it for a tear. And for that, the identification maneuvers that we will see in pathology are important. So this is the segment. The patient is seated with the elbow flexed at 90 degrees and an external rotation, both in this case for the short axis and the long axis. Look at the subtendons that can be perfectly identified in our ultrasound. And we can see them clearly, in this example, position. 1 subscapularis. Short axis, that's the position. To see our image, let's look at it here again and more dynamically. So short axis of the subscapularis, which corresponds to the long axis of the biceps. Look at the position of the probe. The previous one was at 90 degrees with respect to this position. Our schematic drawing then, reading the grayscale, hyperechoic images, skin, subcutaneous tissue, muscle pattern, salt and pepper tendon pattern, bone pattern with posterior acoustic shadow after the hyperechoic image of the cortex. Below the deltoid. So the bursae, in this case the subdeltoid bursa, with its characteristic anechoic or hypoechoic appearance, which is represented in a real ultrasound like this. Let's take a look. So here we've rotated to see the short axis, or the short axis of the scapula, and to look for a footprint that always shows both axes. It's very flat, more so in the long axis than the short, and the subtendons range from 3 or 4 up to 6 subtendons. And we'll see how to determine whether that's pathological or not, or the second structure. They're anatomical features of the shoulder, the subscapularis in the long axis and short axis from position 1.